Hi, I'm Nicole Cutler, a licensed acupuncturist and holistic health advocate. If you have hepatitis C and have been keeping tabs on how successful today's antiviral treatment is, you know that approximately half of the people that complete treatment are lucky enough to beat hepatitis C. However, this statistic is not enough to really understand what is involved in beating the hepatitis C virus. Successfully overcoming a battle with hepatitis C is more complex than taking a simple one-time test. If you are one of the millions living with this leading cause of chronic liver disease, it is helpful to recognize that there is a difference between curing hepatitis C and healing from hepatitis C. The ultimate goal of defeating hepatitis C is twofold: complete eradication of the virus and reversal of the damage done by the virus. First, I want to talk about curing hepatitis C. In hopes of curing this progressive liver disease, medicine's top priority is to rid the body of the hepatitis C virus. As of fall 2009, the most effective way to accomplish this is by combining the medications pegylated interferon and ribavirin. Thus, physicians administering hepatitis C combination therapy primarily focus on its effect on the patient's viral load. The virologic response is used to perceive the success of hepatitis C antiviral treatment. To measure virologic response, a blood test measures how much hepatitis C virus is detectable in the blood. While hepatitis C viral load may be undetectable immediately following treatment, this is not enough to assume that someone has been cured of hepatitis C. This test must be repeated 6 months later to see if any of the virus remained and reproduced. When the virus remains undetectable in the blood for 6 months after hepatitis C therapy is finished, a sustained virologic response, also known as SVR, is considered attained. So far, studies following hepatitis C patients for 2 to 3 years after SVR have demonstrated a low rate of relapse. Although many physicians are wary of equating SVR with a hepatitis C cure, this is the closest measurement we have at this time. Different from curing hepatitis C is healing from hepatitis C. This has to do with the liver recovering from hepatitis C's wrath. Because it indicates a diminished level of liver inflammation, a histologic response means that the liver's health is improving. By revealing the degree of inflammation and liver damage, a biopsy, or equivalent method, exposes the liver's histology. Improvements in histologic scores directly reflect a decreased tendency toward cirrhosis, liver cancer, and liver failure. For those who have achieved SVR, there are no more detectable particles of hepatitis C to continually assault the liver. Thus, a sustained virologic response is always accompanied by a histologic response. However, many people with a histologic response may not have achieved SVR. For those who have not tried combination therapy or did not achieve a sustained virologic response from it, they still have an opportunity to reach a histologic response. In fact, being able to regrow healthy cells and reverse previously incurred liver damage is necessary for preventing the development of cirrhosis or liver cancer. Thus, histologic improvement is an important component in overcoming hepatitis C infection. Creating an ideal environment for the liver to regrow healthy cells and protect the cells it has from any further damage gives anyone a better chance for living with and recovering from hepatitis C. In hopes of improving liver histology, experts in the field agree on the following 7 tips to rejuvenate, support, and protect the liver. The first is to avoid alcohol and recreational drugs. The second is to consistently supplement with milk thistle, an herb proven to enhance liver cell resilience. The third is to fill your diet with wholesome, nutritious foods. The fourth is to reduce your contact with toxins, both ingested and environmental, to an absolute minimum. The fifth is to maintain a regular exercise program. The sixth is to find ways to relax and enjoy every moment you can. And the seventh is to prioritize a good night's sleep. Some physicians consider a sustained virologic response as evidence of curing hepatitis C. However, this is clearly only the first step in the fight against this virus. A positive histologic response is actually the long-term indicator of liver health recovery. The 50% of people who achieve SVR from combination therapy are very lucky. However, by incorporating the 7 steps just described, anyone with hepatitis C can create the right environment for improving their liver's histology.